had a gastric bypass at BMI because I had got to a stage in my life where my weight was beginning to affect me. Predominantly I was getting aches and pains, knees, hips, joints. They were getting worse, you know, and it was beginning to sort of have an effect on my day-to-day working as well as my sort of health. I also had reflux, which was really quite bad as well. You name it, I had tried it. I have been a Weight Watchers girl. I've tried the liquid diets, I've tried the Atkins diet. I was that faddy girl, but my problem wasn't, earlier on, my problem wasn't losing the weight, it's the maintaining it and keeping it off. I've got a dog, I've got 2 teenage children. We do like getting out and about. I was struggling to keep up with them. I was struggling to enjoy holidays with them. So I just felt that if I didn't do something, and I didn't do something that was sustainable, that my life would be on hold and not getting any better, and their lives would be going way ahead and they would be enjoying things without me. And I wanted to be part and parcel of that. That was why I decided to have the gastric bypass. Thought about it long and hard. Had loads of discussions with hubby and decided that that was the route we wanted to go down.
So when I first saw Mandy, her BMI was 38, which puts her in a high-risk category to her, and she was suffering from arthritis in her knees, and she was psychologically quite affected by her weight. It was getting her down. She was very motivated to actually seek some help to try and make changes in her life. If someone is overweight with a BMI certainly over 35, and they've tried other avenues and not succeeding with that, then they should think about surgery. The reason being is that with BMI over 35 there's a increased risk to your life because of developing things like diabetes or heart disease. He
really encouraged, again, both myself and my husband, to look into this surgery ourselves, look into it independently. He gave us all the information that he felt we needed. He talked the procedure itself through. He talked me through what I would need to do beforehand.
The most important thing is when I see patients is that actually weight loss surgery is an adjunct to weight loss, and actually it doesn't do the work for you. You do have to be very selective and very careful in which patients undergo this procedure, because the patient ultimately has to make the lifestyle changes. They have to stick to the diet, they have to do a bit of exercise, and if they work with the weight loss procedure, they can lose 70% of their excess body weight loss with either the bypass or the sleeve gastrectomy.
He never at any point said that this was a miracle cure. It was very much going to be, I needed to work as well, you know. So that, coupled with the research that I did at home, brought me to the decision to do it.
Mandy had the gastric bypass, which is a keyhole procedure, and what it entails is you create a small pouch of stomach to try and restrict how much calories you can take. The operation itself takes about an hour and a half, but the most important thing is the post-op is when patients get mobilising and deep breathing, and they're in hospital for 2 days, usually maximum.
The staff here have just been amazing. The nursing staff that I had on the ward, I was assigned a personal nurse, a lady called Diana, and she was amazing. She knew what I needed before I needed it, and that really helped me. It really did over those first couple of days, you know, when you're sore and aching and stuff. And then she built it up, and she helped me walk, and she got me out of bed. I had access to physio. I saw a physio weekly. I have had a dietitian, Deborah, my dietitian, who has been on speed dial for me. She even texted me on Christmas Day saying, I'm really sorry that you're not enjoying a lovely Christmas dinner, but you know, there's a reason for doing this, and next year you will be back fit and healthy and strong.
I'm delighted with Mandy because everything went absolutely brilliantly with her. The key with it is she was motivated, and I saw that before we decided to do the operation.
7 months on, at the moment I have lost 86 pounds, which is just over 6 stone. And I feel like a different person. I get out with the dog, I can keep up with my husband on the bike. I've never thought of it as being a miracle. I've never thought of it as being the magic cure. I knew that for it to be a success, I had to work hard as well. It's worth the hard work and the expertise combined. it's worth using them both. Use every tool that they give you and move forward.
The whole package entails initial consultation. Every patient gets an endoscopy procedure, which I think is really important. They'll have the operation, have the follow-up for up to 2 years with a dietitian, a specialist and myself. We have a gym here where patients have a 3-month pass to the gym, and they get supervised, almost personal trainer type input twice a week for 3 months. So that's why we think this is the best package around at the moment.
I really would recommend BMI for this surgery. For me, they covered every angle for me. They covered the care, they covered the information, they covered the aftercare. So yeah, I would recommend them in a heartbeat.